I'd like to say good morning to everyone and thank you very much for joining us for this very important briefing. My name is Keith Carson and I am a member of the Alameda County Board of Supervisors representing the 5th District, which includes Albany, Berkeley, Emeryville, Piedmont, and a third of Oakland, including West Oakland and North Oakland, all the way to almost the Fruitvale border. Again, I want to say thank you very much for joining us because I know that your time is precious, but we're going to get some incredible information this morning that I think will impact millions of lives across the country and right here in Alameda County. This morning, we will hear from the Alameda County Federal Legislative Advocates, our advocates who represent Alameda County, CJ Lake, located in Washington, D.C. We've been very fortunate enough to have CJ Lake to be Alameda County's lobbyist for a number of years, and a number of our community-based organizations and the county on a whole has benefited from having this incredible lobbying arm for the Bay Area residents and Alameda County residents in Washington, D.C. Going back to March 2020, Congress has been implementing legislation to provide economic relief from COVID-19. There's been approximately 7 bills before the current American Rescue Plan, which we will hear about today. March 2020, the Coronavirus Preparedness and Response Supplemental Appropriation Act. In 2020, also the Families First Coronavirus Response Act. The Coronavirus Relief and Economic Security Act, which included the $1,200 stimulus checks that people received at that time. Back in April of 2020, Paycheck Protection Program and Healthcare Enhancement Act went into effect. And in June 2020, the Paycheck Protection Program Flexibility Act of 2020. Then in July of 2020, a bill to extend the authority of commitments to the Paycheck Protection Program. And finally, kind of in December of 2020, the Consolidated Appropriations Act of 2021, which included the $600 stimulus checks that people received just before the end of the year. Now it's been a full year later and Congress has passed the American Rescue Plan of 2021. With us this morning to break down what you and I need to know about the American Rescue Plan, we're very fortunate today to have Emily Bakke, the Director of Policy at CJ Lake, Curtis Erdman, the Government Relations Associate, and John Assini, the Government Relations Associate also. As you hear the update that we get from CJ Lake representatives, please feel free to write down your questions. We're going to make sure that we have a little bit of time at the end for questions and answers. Now I'll turn this over to Emily. And again, I want to say thank you very much for all the service that you provide for the residents of Alameda County. Emily.
Thank you, Supervisor Carson. And I think Curtis is going to share his screen and we'll get the slides going. Great. Well, thank you for having us today. John, Curtis, and I are going to give an overview of the American Rescue Package. Again, what it means to the county, individuals in the county, CBOs and nonprofits. And, we know that you serve a lot of these individuals. Next slide, please. So the American Rescue Plan was signed into law last week. Of course, it totals $1.9 trillion. It's just a huge package. And honestly, I don't think any of us saw this coming until January 5th when, the 2 Senate races in Georgia were called for Democrats. And so I just want to make that point because, again, no one saw that this was even a possibility earlier this year. Again, $1.9 trillion. The 2 biggest pieces of the package are, of course, the $350 billion in new relief funds for state and local governments, and then direct aid for individuals. So the $1,400 checks, with which people are already starting to see being directed into their accounts. Next slide, please. So first of all, we're going to talk about the state and local coronavirus fiscal recovery funds, and we're going to get kind of into the weeds here. But again, it's $350 billion, and $195.3 billion goes to states and the District of Columbia. So the state of California is expected to receive $26 billion. This does not include the county and city funds that will ultimately make their way to the state. This is totally separate. And then, of course, there's $130.2 billion for local governments, and that's evenly divided between counties and cities. So $65.1 billion will be allocated to counties based on population, and $65.1 billion will go to cities. Of that, that's then split even further. So $45.57 billion goes to cities over 50,000 in population, and they're using a CDBG formula, which I know a number of you are familiar with. And then for the remaining, for those kind of towns and cities that are under 50,000, that is based on a share of state population for municipalities and what the bill calls non-entitlement governments, which makes sense when you think of CDBG. There are entitlement communities and non-entitlement communities. Next slide, please. So every city and county above 50,000 in population will receive funds directly from the Treasury Department. Municipalities with a population under 50,000 will receive their allocation from the state. And then units of state and local government would be eligible as subrecipients. So, you can think of ports, air districts, universities. Of course, nonprofits are eligible as well, but that gives you a sense of kind of the breadth of subrecipients. And they could be subrecipients for both the state and local pieces. So they'd have kind of two opportunities to try and become subrecipients of that funding. Next slide, please. So we're going to talk about the timeline, and the timelines are different depending on kind of what bucket you fall into. So for states, as I mentioned, they will receive a completely separate allocation totaling $195.3 billion. States will receive this allocation within 60 days of submitting a certification of need to the Treasury Department. Now let's talk about the timeline for counties and municipalities with a population over 50,000 to receive and spend funds. So they are expected to receive the first 50% no later than 60 days after enactment. So as an example, Alameda County is estimated to receive a total of $327 million. The county could expect half, or about $163.5 million, by mid-May. And then they would receive the second half about a year later. Now, for all of these, you need to expend the funds by December 31st, 2024. And although not in statute, we expect Treasury to be releasing FAQs shortly, which will likely include some sort of certification that county or a city administrator will need to complete in order to receive the funds. And if it's similar to how the CARES money went out, the CRF dollars, it would be wired to an account. Now, the timeline for municipalities with a population under 50,000 to receive and spend funds, it's a little bit different. Because that funding is flowing through the state governments, it's not as easy for these guys to receive their funding because it's going to run through the state. So basically how it will work is that Treasury has up to 60 days to send that funding to the state of California. The state will then have 30 days to distribute the funds, but can ask for an extension of up to 120 days. So states need to distribute the funds not later than 120 days after they receive this funding for distribution, or they do face monetary penalty and they would owe money to Treasury. And that would actually come from the state allocation, not from the city allocation. And good news too, the state cannot change the allocations or impose additional requirements on these local governments. Basically, the state just serves as the middleman. Next slide. Now we'll talk about eligible uses of funding. The statute reads for 4 eligible uses. The first is to respond to the public health emergency or its negative economic impacts, including assistance to households, small businesses and nonprofits, or aid to impacted industries such as tourism, travel, and hospitality. Now, it's not limited to just these are simply examples. The second is to provide premium pay to essential workers up to $13 an hour in additional wages. So overtime, and think of first responders, police, fire, etc. The third is to replace lost revenue. And I can't tell you how big this is for local governments. This is something that was not allowed under CARES and for the CRF, and now it is. And this is something that, again, local governments were advocating for since honestly early last summer. And then the fourth is to make necessary investments in water, sewer, or broadband infrastructure. And honestly, this was put in the Senate bill because there were a number of senators who really wanted to focus on building out broadband. Now, we do expect Treasury to release guidance about other eligible uses of funding similar to CARES. They kept releasing FAQs to determine eligible uses, and so we do expect that to happen. One other note, you may have noticed that when we were talking about the state governments and the local governments, it didn't add up to a total of $350 billion. I would just note that there is some funding going to territories, which we left out of the slides. I'm now going to turn it over to John, who's going to start talking about direct payments.
Thanks, Emily. Appreciate the handoff. So as you probably are aware, the most recent relief package, the American Relief Bill, included direct payments. So individuals will receive $1,400 per person, which brings the total relief to $2,000 per individual. As you'll remember, in December, Congress enacted a COVID relief package that provided a direct payment of $600 per person. Under the bill, single filers with incomes up to $75,000, head of household filers with incomes up to $12,500, and joint filers with incomes up to $150,000 will receive the full payment of $1,400. The payment does phase out with individuals earning $80,000, and the limit for couples is $160,000. Additionally, mixed status families will be eligible for the direct payments. We will remember that in the CARES Act, which passed last March, undocumented immigrants using an I-10 and mixed status families were ineligible for the direct payments. Next slide. In addition to the direct payments provided by the Treasury Department, there are also a number of tax credits that were expanded under the American Relief Bill. Particularly, it raises the maximum 2021 earned income tax credit for childless adults from roughly $530 to close to $1,500, and raises the income limit for the credit from $16,000 to about $21,000, and also eliminates the age cap for older workers. This EITC expansion could benefit more than 17,000 childless workers in the United States. Additionally, it expands the 2021 child tax credit to $3,000 annually per child ages 6 to 17, and $3,600 for children under 6, and makes the credit for the first time fully refundable in 2021. And Treasury will be instructed to issue the credit in the form of periodic payments starting as early as July of this year. We estimate, or experts estimate, that strengthening the CTC would increase the average benefit amount for families with children by $2,700 and lift nearly 10 million children above or closer to the federal poverty line. This is also the first time that the United States has instituted a direct child benefit. And then the payments for these are phased down for single filers earning more than $75,000, head of household filers, again, more than $112,500, and joint filers earning more than $150,000. Next slide. In addition to the direct payments and the tax credit expansion, there's also an extension of unemployment benefits. This bill provides $300 per week in supplemental federal pandemic unemployment compensation through September 6th, 2021. This is a decrease of the $400 that was included in the House package, but it was negotiated down after moderate senators had concerns that the $400 per week was too generous. But it does exempt up to $10,200 in unemployment benefits received in 2020 from federal income tax for households making less than $150,000. Previously, this was considered income. And I'm going to hand it off to Curtis for business assistance.
Thank you, John. So the American Rescue Plan provides a number of opportunities for businesses of all sizes to access federal aid. First off, the bill provides $7.2 billion in new funding to the Paycheck Protection Program, also known as PPP, and it expands eligibility to include more 501c nonprofits. The original version of the PPP in the CARES Act only included 501c3 and 501c19 organizations, so there's some expanded eligibility there. The bill also provides an additional $15 billion in new funding for targeted economic injury disaster loans, or EIDL grants, to provide hard-hit, underserved small businesses with flexible grant relief. It's estimated that these grants will be particularly helpful for the smallest businesses as well as sole proprietors. That encompasses around 90% of minority-owned businesses that have been disproportionately affected by the pandemic. And then moving on to funding specifically for community organizations, SBA resource partners, and community financial institutions. The bill provides $175 million for these groups. The groups need to have experience working in minority, migrant, immigrant, and rural communities, and these funds will allow them to serve as community navigators to help connect these small business owners with resources such as small business loans, business licenses, and then help them get access to federal, state, and local business assistance programs. Lastly, for the Economic Development Administration, they'll be receiving $3 billion to aid with rebuilding local economies, and $750 million of these funds are specifically reserved for the travel and tourism sectors. Next, I'll move on to housing and rental assistance programs. So just some top lines. The bill includes $21.6 billion in additional funds for the Emergency Rental Assistance Program. You may recall that the December COVID relief package provided $25 billion in emergency rental assistance. Congress, especially Democrats in Congress, thought that this was a good start, but there's an estimated $57 billion in back rent and back utilities costs that renters owed as of January 2021. So they're trying to meet that need where it is. So these funds will flow in the same way that emergency rental assistance funds flowed from the December package, and funds can be used in the same way for rental and rental arrears, as well as utilities and utility arrear costs. Then for homeless assistance specifically, there's $5 billion in the package for homeless assistance to help communities provide supportive services, as well as safe and socially distant housing to the over 500,000 individuals experiencing homelessness during the pandemic. Funds can also be used by grantees to purchase properties like hotels and motels, so they can be used as non-congregate shelters, as well as for other supportive services. Then moving on, just a brief note on housing choice vouchers. There's $5 billion for these vouchers, and they'll be reserved for the high need and at-risk families and youth, and funds must be used to provide stable housing. Then another piece is the Home Investment Partnerships Program. This is run through HUD, and they'll be receiving an additional $5 billion. These funds typically flow as formula grants to state and local governments. And lastly, for housing assistance, we'll talk about the Homeowner Assistance Fund. There's $10 billion in the American Rescue Plan for this. And it's to help the estimated 3.3 million homeowners who are behind on their mortgage, their utilities, and their property tax payments. We've seen a lot of forbearance and trying to make sure that these people can stay in their homes, but this is the first funding dedicated specifically to homeowners since the pandemic began. And millions of forbearance plans are set to expire in the months ahead if they're not extended. So this funding will flow through the Treasury directly to states who can then allocate to individuals and families. I'll pass it off now for a discussion on vaccines, healthcare, and some other provisions.
Thanks, Curtis. So $47.8 billion is going to HHS to support state and local health departments for testing, acquiring and distributing PPE and other supplies, and expanding contact tracing capabilities. There's $20 billion to establish a national COVID-19 vaccination program. And of that, $7.5 billion will be allocated to the CDC to support state, local, tribal, and public health departments and community health centers in the distribution of vaccines. This should start to flow within 21 days of enactment. There's also $1 billion for the CDC to strengthen vaccine confidence by furthering the distribution of information and education and improving vaccination rates. Wanted to make this note because, I think that some of this could probably serve some of these CBOs that are on this call very well to get the word out to folks who are having trouble getting vaccinated at this point and kind of the hard to reach people. Next slide, please. As far as childcare and early learning, there's $39 billion included for the Child Care and Development Block Grant. And this is for childcare providers, and it does provide financial relief for families struggling to cover the cost of tuition. It increases the annual funding level for the child care entitlement to states from $2.917 billion per year to $3.55 billion per year. This is huge increase. And then it waives the state match requirement for funds for fiscal years 21 and 22. There's also $1 billion for the Head Start program, and Head Start has continuously received additional funding throughout these COVID relief packages. And then they added $1 billion for a new program for TANF Pandemic Emergency Fund to be distributed to states and tribal governments. Next slide, please. Next, we'll talk about nutrition assistance. The bill will extend the 15% increases in SNAP benefits through September 30th, 2021 to address the hunger crisis. The bill extends the pandemic EBT program through the summer months in both FY 21 and 22, so that families have access to school meals and food assistance during both the school year and summer months. And then it also provides an $800 million allocation for WIC to fund a temporary 4-month increase in the value of WIC food vouchers. And it expands the age of eligibility for the USDA's child and adult care food programs. So now young adults up to age 25 can access nutrition support. I'll now turn it over to John, who will talk a good bit about the healthcare provisions.
Thanks, Emily. So under this bill, more individuals and families will now be eligible for subsidies under the Affordable Care Act. This is considered the largest expansion of the Affordable Care Act provision since the bill passed in 2010. Enrollees with incomes between 100% and 150% of the federal poverty level will receive benchmark silver level coverage for plans for free. And for the first time, subsidies will also be available to people with incomes above the 400% of the poverty level. Previously, subsidies cut off once you hit 400% of the poverty level or went slightly above that. The bill adds cost sharing support for unemployed enrolled individuals in a qualified health plan by saying that any person who receives unemployment benefits for any week during 2021 meets the requirements for an eligible insured under the ACA. Previously, cost sharing support was prohibited for any individual that enrolled in unemployment insurance. It also provides that any individual who received unemployment at any point in 2021 is eligible for a more generous ACA marketplace subsidy. Additionally, it covers 100% of COBRA insurance premiums to maintain employer-sponsored coverage after a layoff, a reduction in hours, or a furlough through September 30th, 2021. This bill increased that subsidy amount from 85% that was included in the House passed version to now 100%, which is in law. It also requires state Medicaid and CHIP plans to cover 100% of testing and treatment for COVID-19 for beneficiaries through the end of the public health emergency. Next slide. In addition to the individual healthcare provisions in the law, there are also several expansions of mental health funding available through the federal government. First, it provides $1.5 billion for SAMHSA, known as the Substance Abuse and Mental Health Services Agency, within the Substance Abuse Prevention and Treatment Program. Additionally, it provides $1.5 billion for the Community Mental Health Block Grant Program, $420 million for the Community Behavioral Health Clinic Program, $80 million to the Pediatric Mental Health Care Access Program, and $30 million for SAMHSA to create a grant system to grant states, local governments, and tribal governments to support community-based overdose prevention programs and other harm reduction services in light of the increased pandemic-related drug misuse. And I'm going to hand it over to Curtis to talk about the elder care provisions.
Thank you, John. So just as we've seen in previous COVID relief bills, Older Americans Act programs will receive additional emergency funding. As you can see here, the bill provides a total of $1.4 billion in funding for OAA programs. $750 million has been allocated for senior nutrition programs, including the Congregate Nutrition Program and the Home Delivered Nutrition Program. $460 million has been provided for home and community-based support services. $45 million has been allocated for disease prevention, $10 million for the long-term care ombudsman program, and $145 million in assistance for grandparents caring for one or more grandchildren. I'll move on to FEMA briefly. So the American Rescue Plan will provide $50 billion for the Disaster Relief Fund, or the DRF. The DRF assists states, individuals, and qualifying nonprofits as they respond to the pandemic. These funds can be used for PPE, for vaccine distribution, for sanitization costs at schools and on public transit, as well as other needs. This money can also be used to extend the funeral assistance program. We have a note here that the American Rescue Plan extends the 100% federal cost share increase for funeral assistance that's provided by FEMA. Originally, you could only use this funding for costs incurred before December 30th, 2020. So they extended that. There's also $510 million for FEMA's emergency food and shelter program. Funds can be used to support homeless service providers for costs related to overnight shelter, for meals, for assistance to food banks and pantries. And there's also a provision to provide 1 month of rental, mortgage, or utility assistance in order to prevent an eviction or a service cut. I just want to make a note that $110 million of that $510 million has been reserved to support communities and organizations assisting migrant families and individuals during the COVID-19 emergency. I know we've thrown a lot out at you. Thank you for bearing with us. I'm going to pass it back to Emily for any final notes, and then I think we can open it up for some questions.
Sure. As Curtis said, we have thrown a lot at you. I mean, it's $1.9 trillion. One thing I will note about PPP, and I don't know that Curtis brought this up, there was some additional funding included for PPP, which is great news, but the program is set to expire at the end of this month. So I know there have been some questions related to that. The House actually passed a bill yesterday that would extend PPP through the end of May. And honestly, the Senate is expected to take it up next week, and we do think it will pass. And so not only will there be additional funding, but there's now more time to apply for PPP. And now I'll turn it back to Supervisor Carson.
Yeah, thank you very much, CJ Lake, for giving us that overview. First, I want everyone online to know that we'll make sure that we send out copies of the presentation, because there was a lot for you to digest. And so you'll be able to get that. And before we go through the questions, I also want to say that while you got these and these numbers, and they were pretty massive in terms of what was passed on a federal level, keep in mind that those monies go to the state, those monies go to counties and cities to enact the programs that they listed that are there. And that's a very fundamental part of this presentation, just to get a sense of the categories, especially that you serve in, that your constituency serve in, the categories that are funded, those are categories that either the cities and or the counties will have some process going on to appropriate those dollars to make sure that they get to the intended people who are defined in each of the sections of the bill. With that, I'm going to have Amy, who put together together today's presentation. I want to say a big thank you to Amy on our staff, and we'll go through the questions and answers. So Amy, I'm going to turn it over to you to navigate the questions and answers. I know some came through the chat, and there may be some additional questions coming in.
Yeah, so I think this first question maybe is for Curtis. In reference to the lobbying organizations, is that 501c6s or a different type of organization?
I think there are certain organizations that can be described as 501c6s that are eligible, but the specific lobbying organizations described under 501c6 are not eligible. We can provide even more background, but I believe that's correct. Okay.
And then Ralph Silber from the Community Clinic Consortium asked, California is already providing additional subsidies for ACA. Does the increased federal subsidy mean replacing the existing enhanced state subsidy, or is it an actual increase in the subsidy?
It would be an actual increase to the subsidy from the federal government.
Okay, great. And then we have a question maybe for Supervisor Carson. How will Alameda County distribute funds to community-based organizations? Will there be an RFP process?
There will be multiple RFQ processes that will go forward. Let me say, for individuals who have been following the county process, we've actually began already this past Tuesday to start to talk about distribution and redistribution of these funds as they come forth. The board will have an open process. Departments that oversee the certain areas where dollars will flow through, such as healthcare, such social services, our general service administration, and other levels of government will have their committee process. There will be announcements that are constantly coming over the internet for organizations and entities to apply to. And we have a number of open processes that mean you have a chance to speak at those meetings and present at those meetings in order to get access to the dollars. And then we want to make sure that we're doing an ongoing review process to ensure that that the intended individuals who the law is designed for, in fact, have access to the opportunities to get those dollars, either in rent relief, in food support, in health care support. And obviously, since we're an extremely diverse community on multiple levels, rural, suburban, urban, ethnic, organizationally, and otherwise, we want to make sure that all intended communities are at the table to be heard and understand. A lot of this is going to be driven by data, information which lets us know who needs the service, where they live. A lot of that is how we make sure that if you didn't get in on the round of funding last March up until December, we want to make sure that at least you have your voices heard in trying to redirect some of those funds to you. So very open, transparent process, which has already began. And we're encouraging each and every one of you to be engaged on every step of the level. If you're not at the table and not raising your voice, then it's hard for us to be able to figure out the maximum way in which we can serve you.
Thanks. So on housing and homelessness, how will the relief funding directly impact homelessness and ongoing housing issues?
Well, I'll take a stab at this. I mean, there are a number of programs that Curtis ran through. Some of those will flow through the state, as he said, and I think the state may need to put together some programs, and they'll likely be reaching out to local governments to establish those. And then some will flow, as they already do, through formula. And again, those go through local governments. The other piece, there's still additional funding for the emergency rental assistance that I know the county is standing up their program right now from December, from that emergency rental assistance. And so there will be some additional funding there as well. So I imagine, again, it's going to flow through both the state and the local governments to address the rental assistance needs and the homelessness needs.
And then someone had a question. Can we get an explanation of the CDBG formula?
So you're probably going to stump me there. But in general, that is a HUD program, the Community Development Block Grant Program. And I know that in general, there are cities and counties that receive direct funding from HUD because they are listed as entitlement communities. And so those are the ones, again, above 50,000 in general, that are receiving direct funding from these allocations. So it's the county, and then it's the city of Alameda, the city of Berkeley, Fremont, Hayward, Livermore, Oakland, Pleasanton, San Leandro, and Union City. So all of them are receiving direct funds from Treasury because they already received direct funding from HUD as part of CDBG. I can get you a more detailed answer after about the exact HUD formula if you'd like that. And again, I know you've seen estimates of the funding, and I even quoted the estimate for the county. I would just add that those are estimates, and all those are right now from the House Committee on Oversight. Treasury will actually put out the exact dollar amounts. Now, we think these estimates are very close, but I just want to caution they may not be the exact amounts that ultimately flow.
Let me just add a caveat to that for just a moment, especially for people who may not be directly aware of how the lobbying effort works. This is one clear area where CJ Lake has really been helpful to Alameda County when we've had to go over to the Housing and Urban Development Department in Washington, D.C. to talk about formulas and formulas of dollars that are coming either to California, to Alameda County. To be able to have access to legislative decision makers, the ability to have access to staff that are actually doing the prep work for which these decisions are made, especially about formulas and allocation of funds. We've had incredible support from CJ Lake in terms of having direct communication with the decision makers and advocating on behalf of California and advocating on behalf of Alameda County. And I just want to offer that up more publicly for people who don't necessarily know the nuances of the lobbying effort.
Thanks. The other thing I would add related to kind of HUD CDBG formula that they're using, I honestly think this was the easiest way to get the funding out the door the fastest. One of the big concerns that local governments had with CARES is that only local governments with populations above 500,000 received direct funding. And so everyone else had to go through the state, which was a big problem. And so as House Democrats were working on HEROES and HEROES 2.0, and then this package, there was a big push to have direct funding go to municipalities and counties, regardless of population, but you couldn't get all that direct funding to some of those smaller ones, below 50,000. I think it was going to be too difficult for Treasury to do that. So that's why they used that HUD formula, sending most of it kind of that way, and then the rest through the state.
So here's a question about nutrition. What is the POA to continue to distribute healthy, nutritious meals? I think.
So there are a couple things. I'm not sure kind of exactly what this question is asking, if it's like through the county or not, but I would say, the pandemic EBT will allow for the continuous to ensure that families and children, school-age children, are receiving these meals, these nutritious meals, through the summer of this year and next year. But other than that, I'm not certain I fully understand the question.
I think maybe it is more for the county and how we're going to distribute resources. And I think, as Keith said, we're taking a look at how we do things going forward. So about education, what direct impact of ESSERFs and HEERFs address learning loss? What percent and how will and when will relief be allocated to special needs students? I don't know that I know those acronyms, so maybe.
And I don't know that I know those either. And honestly, we didn't really touch on education as much. I know that I think they're sending out like 10 billion in the next month or so. The White House just announced to help schools reopen. But in terms of learning loss, I don't know if Curtis or John have something more specific.
I know that the American Rescue Plan did include money to specifically address learning loss. Yesterday, the Department of Education put out their plan that would address this, and we can provide it, the press release that they provided to achieve that. I believe $122 billion will be provided to K through 12 schools, but I'm not 100% sure how much of that will be dedicated specifically for learning loss.
And then on the child care relief benefits, is there information on who's eligible and how? Is that through local application as well?
Sorry, I needed to unmute myself. So if you're referring to the CCDBG, the Child Care and Development Block Grant, that flows through the state. And so I believe the state should have some sort of portal or application, and it may run through the locals as well. But that is something that has been in place for years. They're simply plussing it up. So there's already a process in place.
Great. So we have a little bit more time for questions. So if people want to raise their hands to ask their questions, I can unmute you and allow you to ask your question. So the first one we have is from Ms. Omawale Foles. You'll need to unmute.
Hi, how are you? Can you hear me?
Yes, go ahead.
Good. Our question has been that the county is taking in referrals this week from the 15th, starting on this past Monday through this Friday. And we were not sure who that referred to in terms of homeless clients. And we wanted to know if we could get funding for our roof over their heads emergency to permanent housing fund so that we could put them into housing immediately. They have been through the BACS process. Some have had housing assessments, some have not. Most of our clients have not received case managers.
Ms. Foles, that's a question. I can certainly have Emma Ishii in our office follow up with you. Our lobbyist from CJ Lake wouldn't be able to answer that. So I'll have Emma get a hold of you.
Okay, great. I think one of the sub parts under homeless and housing you have already addressed, and I think that's where we're supposed to apply. But I will wait until you send us the documentation because it is a bit overwhelming.
No problem. If anyone else would like to ask a question, you can raise your hand and I can unmute you.
And Amy, while you're waiting for more questions, there was one thing I wanted to add on the FEMA assistance, and particularly on the funeral assistance. There was just a hearing this week on the House side, and the FEMA administrator was there, and people were asking, how do we get this funeral assistance? It was first enacted in December, and we still haven't seen anything. And he said they are working on rolling out the program right now, and that it should be up and running in April. He also said that there would be some sort of call-in rather than online portal. So just wanted to flag that. It probably won't happen until April.
That's great. I'm going to have next is a question from Ralph Silber from the Community Clinic Consortium.
Hi, this is about the PPP loans. I understand the bill extends eligibility to nonprofits that have more than 500 employees, as long as they don't have more than 500 at any given site. But then I understand under the pre-existing law, loans applications have to be filed by the end of March, but there was going to be a bipartisan effort to extend that deadline. Any update on whether that bipartisan extension is really going to happen? Because otherwise people are going to be working 24 hours a day between now and the end of March to get those applications done.
Yeah, so I had mentioned this briefly, but the House actually passed a bipartisan bill yesterday that would extend it through May, and the Senate is set to take up the bill next week. So we do think it is moving. You know, Congress likes to wait until the last minute, and which is not always good for constituents, but it should pass.
Great. Next, we have LJ Jennings.
Good morning. Thank you so much for this call, Supervisor Carson and lobbyists. A couple questions. One question on the Emergency Rental Assistance Program. HCD had, Housing Community Development, had some questions about the administration costs. I know that there's two pots, state and federal. Does either pot allow for the administration of the funds, not necessarily by the government entity, but allowing CBOs to use some of those funds for administration of those funds? That's part one. Part two is with regards to homelessness and housing. As the individual was going through the use of those funds, I thought I heard something in that presentation about some of those funds could be used to acquire property. Is that limited to just the municipality, or is that extended to CBOs?
Emily, do you want to take the first one?
So the first piece about the emergency rental assistance, honestly, I think you said state and federal, but it's really state and local. I mean, the federal government is, funding it, but the money is going straight to the locals and the state. So as far as the administration of funds, Amy, I'm going to actually pitch it to you and defer to you, because I'm assuming as you all are standing up your program, you will have requirements in there, because I don't believe the feds had anything in statute.
We can certainly, Supervisor Carson can hop on here.
Yeah. Let me just say, and I know that Pastor Jennings has been following this pretty closely. I think that that's an area, administration funds going to our community-based groups is something that we should continue to pitch and put at the table, because obviously for those that have the capacity as community-based groups to acquire property in which you will be housing individuals who are either unsheltered or at a certain poverty rate. I think that fits within at least the spirit of the and the intent of the law for us to be able to acquire those properties. So I think that that's something we should continue to push for. Obviously, the administration for the municipality, in this case, Alameda County, there is obviously an administrative fee that is coming off in order to administer it. And for those of you who are directly putting this into place to acquire property for the purpose of habitating individuals who are unsheltered, I think that's something that we should be pushing for.
And then we had a question from Donald Frazier at BOSS. In the previous bill, business owners with felony backgrounds did not qualify for CARES Act funds. And his question is, has that exclusion been removed?
I think I can take this one. I know that the exclusion, I I know at least under the PPP that exclusion has been removed. I think there are some cases, if there's been a financial fraud related case, then these people will remain ineligible. But I know that it was expanded, of course, with that distinction with fraud.
And so that's all the questions I see. Let me just give people one. I think, yeah, that's all of our questions. I'll turn it back over to Supervisor Carson.
Yeah, again, I want to thank CJ Lake for the ongoing work that they've been doing on behalf of the residents of Alameda County and Alameda County, and for the outcomes that we've received over the years. I first want to say that. For those of you who are attending today's webinar, every Monday at 1:30, the county does have its Policy Administration and Legislative Committee, which is an open committee, and a lot of time people do follow it other than just county staff and department heads. That's a way for another way to be updated about the actions that are going on in Washington, D.C. as well as in Sacramento. We are your local government, county and cities, and so we're more direct access to these issues. But we wanted to make sure that you had an opportunity to talk with people who know better and the insides and the outsides of the legislation as it goes forward, and that is CJ Lake in this particular case. With that, I want to end by saying thank you to all who participated, and even more so, thank you for the work that you're doing each and every day. Many of you are having direct contact with people who are in need and having to navigate even the emotional part of that by dealing with people directly. And the work that you do is really the building block under which we try to support that with legislation and also the financing to carry out the good work that's needed for people who are seeking help in our safety net, which is Alameda County. With that, I want to say thank you very much. I appreciate it, and I hope that everyone has a great day. Take care.
Thank you.
Thank you.
Thank you.